Assalamualaikum and very good morning. My name Mohamad Afiq Ikhwan Rosmidi with metric number 192153, and this is my cat named Muna, and today we will demonstrate how to do physical examination on a cat. Let's begin. Okay, so firstly, once the client enter the examination room, we have to put the cat outside from the carrier so that we can observe their mentation, their gait, and observe their behavior. We also can observe if there's any lameness to the cat based on during when they are walking, and see whether they have a good gait or not. Okay, so next we take the TPR of a cat and we start with the pulse rate. The normal pulse rate for a cat is 120 and 240 beats per minute, and we put the diaphragm of the stethoscope on the left side of the chest of the cat. And then we move on to the temperature. So we take the thermometer and put into the rectum wall of a cat, and the normal temperature is 38.5 to 39.5. And then lastly we observe for the respiratory rate, which is the normal is 20 to 40 breaths per minute. Okay, now we start with the hands-on examination. So firstly, the general rule of thumb is we have to hold as little as possible, and we assess the shape and symmetry of the skull first, and then we check for the eye position and the composition of the cat to see the movement of the eye, the vision, the eyelid, the conjunctiva, and then we check for the pupillary response with pen light, and we check for the palpebral response, and we also should check if there is any ocular discharge from the cats. And then we move on to the ear examination. So for the ear examination, we have to observe the external ear to see if there's any discharge, and then we can use otoscope to examine the internal ear, the internal ear canal and the tympanic membrane. And next we move on to the nose to see the bridge of the external nose shape, the color, the symmetry, and if there's any erosion, and examine nails for the discharge. And next we examine the oral cavity. So we open the cat's mouth to see if there's any erosion or ulcer, and the teeth, make sure it is clean, no tartar or whatsoever. And then we slip a bit the gum of the cat and to check for the capillary refill time, and this cat is less than 2, which is good. And then next we move on to the lymph node palpation. So this time I'll try to palpate the mandibular lymph node to see if there's any infection occur, if the lymph node getting bigger or not. And next I try to flex the necks of the cat dorsally, laterally, and ventrally, and turn around to assess if there's any pain, and I palpate slightly the thyroid gland. Next step is integument. So firstly we run both our hand through the cat's body and check if there's any flea dirt or flea eggs in between of the cat fur, and then we also can use the flea comb to check for it. Don't forget, we also need to check the ventral part of the cat to make sure everything is good, and the most important thing is we have to check for the dehydration status by doing skin tan, and make sure the cat is highly hydrated. The next step is forelimb. So for the forelimb, we have to examine each forelimb from digit to scapula, and we have to palpate the muscle, the joints, and the long bone of the cat. We also need to examine the nail bed, the foot pad for color and symmetry, and we have to try the palpate each foot in the knuckling position to see if they shows any sign of pain, and we try to palpate the prescapular lymph node of the cat. Next we move on to the thorax. So for the thorax, we have to observe and palpate the ribs for the integrity and symmetry, and then we have to palpate the spine by applying gentle pressure downwards, so that we can observe if the cat shows any sign of pain. And then we have to auscultate the thorax. So it is suggested that we palpate the right side and the left side of the cat, because from the right side we should be able to hear the tricuspid valve, and the left side the pulmonic valve, the aortic valve, and the mitral valve. And we should also hear the respiratory sounds if they shows any abnormalities, or if the cat have problem with the airways. Okay, next we move on to the abdomen. So for the abdomen, we have to palpate the abdomen from cranial to caudal and dorsal to ventral. So by using tip of finger, we can use it to find any masses in the abdomen, and we should and if the bladder is full, we also should be able to feel the bladder in the abdomen. And next we move on to the hind limb and tail. So for the hind limb, the examination is just like the forelimb, which is we have to palpate from the digit into the upper part of the leg, and we should put pressure in between the bone to feel the muscle, to feel the ligament, and if the cat have problem, the cat will show signs of pain, and we also should test the tail by pulling base of the tail craniodorsally to assess the lumbosacral pain. So next is external urogenital and perineal area. So during this time, we should examine the external vulva and look for if there's any discharge or swelling. Normally, this only occur in an old cat which haven't been spayed yet. And lastly is a rectum examination. So for the rectum examination, we should evaluate the pelvic and the sacrum contour and palpate the dorsal aspect of the rectum. I think that's all from us. Bye bye.